I also have inserted myself in a lot of other areas in liver. I serve on the AASLD, or the American Association for the Study of Liver Disease, on the Practice Guidelines Committee. I'm the president of United Liver, which is a local organization in New Mexico and Arizona. And we serve patients, linkage to care for rural areas and patient education. I'm on the medical executive committee for Donate Life Arizona, and I'm a program director for Project ECHO. So if anybody's interested in learning more about any of those organizations, please let me know. I'm also very involved in viral hepatitis education and elimination around the country and now the globe. So that being said, I'm also a liver patient. So my journey started with my dad, who went in for a routine contrast dye procedure for heart disease. He didn't have any issues, but his doctor said, you know, you're at the age where we should probably check it out and see what's going on, and did a routine test, and his kidneys failed. So it was an allergy to the dye that they weren't expecting. They had neglected to do a test that should have prevented that from happening. And I ended up becoming a living donor for my dad, kidney donor. And that was quite a process. But it also helped me understand how to become a caregiver, and we have some caregivers in the room, I bet, and a few of you. They are the most important parts of our journey as patients, for sure. But then I found out later, after that happened, my dad passed away, unfortunately, but found out later that that I was having a surprise baby. So surprise at an older age. And then after I had her, I had these symptoms. It was very strange. I was feeling tired. I had brain fog. I couldn't lose weight. I just was really exhausted all the time. I went to my primary care doctor, who prescribed me antidepressants, benzodiazepines, several different medications, to the point where I couldn't remember getting from point A to point Z, and thought, this is probably not healthy for me to be driving kids around in a car when I'm medicated like this, and still don't know what's wrong with me. Went to a few other doctors, was diagnosed with potential Lyme disease, fibromyalgia. Some of these key terms might sound familiar to a lot of you who have had the same journey. You'll be fine. You just need to get some more exercise and lose weight. Finally went to a rheumatologist who wasn't quite sure what to do either, but they had a clinical trial running in their office for a new technology of scanning that could determine whether or not your liver was healthy. Didn't know anything about it, but thought, sure, we'll give it a try. And found out that I had non-alcoholic steatohepatitis, or metabolic associated liver disease, which is stiffening of the liver, and fatty liver. So basically I had an excess of fat buildup in my liver for many different reasons, and was overweight at the time. Went through a process to try to correct that, and my prayers were answered, basically because I had figured out that I wasn't overly depressed, I didn't have anxiety. Of all of these issues, there's an answer finally, and a lot of it had to do with what I was eating and what I was exposing myself to, and my lack of exercise, and some genetic factors that I didn't realize I had. So then it hit me, and my journey in advocacy really began, because it took me so long. It took me years to get that diagnosis. It took me so long to get that diagnosis, and there was so little education out there. I then realized that when doctors go to medical school, there are 6 pages in their textbook that cover liver disease. 6 pages only. And it gives you the basics of liver disease. So it's no wonder that our primary care physicians don't understand much about liver or how it works. It's not the sexiest organ ever. It's not your heart. It's kind of one of those things that nobody wants to talk about. What do you all think of when you hear the word cirrhosis? Alcoholism, right? All liver disease, more than 100 types of liver disease can lead to cirrhosis. Cirrhosis is just simply the scarring of liver tissue, and it can happen from any liver disease, not just alcoholism. But because of the stigma that is associated with the liver and liver disease, we all instantly think of alcoholism or drug use as it applies to liver disease. But it can happen with any form of liver disease, including pediatric liver disease. So a diagnosis can be scary. The rate of progression of liver disease really depends on so many different factors, including genetics, including so many different things. So then after that journey, I really wanted to understand more about why it took me so long to get the diagnosis, and why we have to be our advocates. And I think I see a lot of folks in this room that are probably similar in age to me. We were taught growing up to trust our doctors and to really listen to what our doctors say and to have faith in what they say. Can everyone agree with that over, for the most part? But medicine has changed, and the ability of our doctors and the way that the system is now has really limited the ability of our doctors to have all of the pieces of the puzzle. And so although they are well-meaning and they have our best intentions at heart, their system and what they have to deal with is not set up to take the best care of us. So we have to become our own advocates. And what does that mean? Really becoming our own advocates means standing up for ourselves, knowing more about our medical problems and situations and journey than our doctors do. It's our responsibility now to take our medical information to our doctors everywhere we go. And I see our caregivers shaking their head, yes, yes, that's right. You have to know more about your medical journey or your loved one's medical journey than our doctors do, because you go into a room and they're looking at a screen or their laptop or their phone with your electronic medical record, and they're not seeing the big picture. They might not have the ability to remember every piece of your case. They remember you, and they remember your journey, and they remember your story, but they might not remember that your lipids were elevated last time you came in. So that's something that you need to remind them of, so that your medication can be adjusted appropriately. Does that make sense to everybody? Is that ringing some bells here? Yeah. So that being said, there are so many places I can start, I don't even know, but I would like to review what the Advanced Advocacy Academy is and how I got here. Our founder of our organization, Global Liver Institute, is a 31-year liver transplant survivor. She started the Advanced Advocacy Academy, and actually Andrea Wilson was a member of the first generation of the first graduating class of the Advanced Advocacy Academy. And really the purpose of it was to have patients and caregivers come into a room and help them understand what liver health is about, because not everybody knows even where their liver is or what it does or what size it is and what the purpose of it is. Basically the basics of liver disease, what kinds of liver disease are there, what types of liver disease are there, what does liver health mean, what does the liver do, what pieces are important to me to know to keep my liver healthy, how can I avoid drug-induced liver disease, not overdose on something like Tylenol or ibuprofen, or where might extra medication be hiding in what's over the counter that we see every day. So we learn things like that at Advanced Advocacy Academy. Also, how to tell your story as a patient or a caregiver. So, a lot of us like to talk about stories and tell our stories, but we're not sure exactly how it can be best used. And how can we tell our story to our doctors or to legislators or policymakers who can influence change for us on behalf of our patients or our caregivers in our community to make a difference. And so that's what we really focus on, clinical trials. Who thinks clinical trials are scary? Me. So clinical trials are kind of one of those things we don't know a lot about. So how can we learn about clinical trials and demystify them so that we understand that they're not just taking our body parts and our pieces and hiding them in a box somewhere, that actually is for drug development reasons and drug development purposes, and the medications can have a lasting effect and positive effect in the community. So the Advanced Advocacy Academy takes place in person once a year, and typically in the fall, and we convene typically 30 to 100 patients depending on how much interest we have that year. And it's a 4-day learning experience, and we have a reception, and then we have classes, and it's much like this where we have a didactic but also workshops, so that you get to know peers and you get to know other caregivers and patients who have had the same journey or the same story or similar stories, and understand different components of what liver literacy means, what liver advocacy means, and then how to talk to people who can make a difference, how to talk to lawmakers, how to talk to council people. When I started this, I had no idea how to approach a council person or why I would even do that in the first place. So this explains how and why it's important. We talked a little bit about food literacy and food access to fresh foods and hidden labels and things like, things that might be hidden in our foods that we don't know about. And it might be labeled as low fat, but that doesn't mean it's good for you. That's the kind of policy change. Lunches you see in schools, that kind of thing. So this is what we teach you how to do. This is a breakdown of the Advanced Advocacy Academy participants. It's largely made up of patients, but lots of family members, lots of caregivers, and then providers and parents of patients as well. We give you a textbook basically that goes along with your journey, and it covers all of the different pillars, including liver literacy, which is basic liver education, media and storytelling, how to navigate social media. It's kind of difficult to know how to do posts sometimes and how to communicate via social media if you're interested in learning more about that. And then let's say you have a story like Teresa did on the news. What's the best story to tell, and how's the best way to tell your story to make a difference in people's lives? How can you tell your story most impactfully in 2 minutes or less? What clinical research and development means, so we kind of break down what drug development is and why it's important and how it can apply to patients and how it can be used to your benefit. Navigating healthcare coverage is a big one for all of us probably. How do you know what an insurance company is going to cover, especially with a lot of the drugs in liver these days and the new medications that are coming out for fatty liver disease. Insurance companies now will often just automatically deny your claim. And this happens with viral hepatitis as well. The reason is the medications are incredibly expensive. And so it's a dirty trick that some of the payers or insurance companies will play when the doctors will prescribe in good faith these medications. The insurance company will deny it or will make you jump through 1,000 hoops to get the medication. And your doctor doesn't even know it's happening. And so you have a denial, and the next time you go to the doctor, they say, okay, how's your medication going? And they don't know that you haven't even been put on it yet, right? Or that you've gotten a denial or a claim or an appeal, you've been pushed to appeal. So it's kind of an attrition tactic of some of our payers to sift out patients, because they know a lot of doctors and hospitals and clinics won't even attempt to try and be put on a different medication. So that's something we teach you how to navigate. And understanding policy and meeting with policymakers, which is basically your local, national lawmakers and how they can influence different bills, hepatitis C acts, things like that. Resources, liver literacy, support groups, peer pages or peer groups. We connect you with all of those folks, which is great. We have an ambassador program for people who are graduating from A3. You receive a certificate, and then you have an option to become an ambassador and really teach other people or be connected to our community and continue the cycle of the Liver Action Network. So for instance, Teresa has sent some of her patients and caregivers from her organization to us for Advanced Advocacy Academy, and then as ambassadors, they go back into the community and teach and train and have a better understanding of what liver literacy and health is. And then this is just, you can read it yourself or I can talk about it, but some examples of how some of our A3 graduates have been effective in the community. Andrea, she didn't need our help, but she certainly has done a lot in the community as far as advocacy is concerned, absolutely. And many of our graduates have gone on to form or have already come into the academy with their own ideas about advocacy organizations. And typically this is more for someone like Teresa's group, but we invite you to apply for the Advanced Advocacy Academy. It's really a wonderful program. We also have a virtual component, so if you're not able to travel or for some reason our scholarships fill up before you're able to apply and you're interested in going through the program, please feel free to email me or get in touch with me or talk to me before I leave, because we'd love to have you go through the virtual component of that. And all of the same applies. You can still become an ambassador and all that good stuff. But to touch on a few points, I know there were a lot of questions about liver, but when it comes to NASH or fatty liver specifically, and I'm not a doctor, I'm a plant doctor, but not a human doctor, truly. But it is important to understand that most hepatologists will say to you that 10% body fat loss or weight loss is important. So if you weigh 300 pounds and you can lose 30 pounds, that will do a lot for you in, as far as health is concerned. If you can cut out processed foods or ultra-processed foods, that's very important to do. Anything that comes in a package, try to not eat it. For instance, if you have a choice of choosing an apple, a fresh apple, or a piece of apple pie, it's better to choose a fresh apple. Now the problem is that your brain is telling you that apple pie is better. Why? Because it has more sugar. And sugar has the same effect as heroin on our brains. Did you know that? So that's a very interesting thing, that naltrexone, which is a drug that can be used for people who struggle with opiate addictions, people who struggle with alcohol addictions. Naltrexone is also used for people who have eating disorders, which is overeating or too much eating, or cannot stop eating sugary foods, because sugar has the same effect on our brains as heroin. So that's why it's hard to stop. That's why. It makes you feel good, and it creates this addictive pattern. So it makes it difficult to stop eating sugar. I can promise you that if you do try, I have tasted lettuce that actually tastes sweet to me before. I can taste the sugar in lettuce now, which I never could do before. I know it sounds strange, but and my talk is going way off topic, but that's okay. You can taste, if you cut out sugar completely in your diet, and you just eat sugar that comes from fruits and vegetables and things like that, and not from a package, things start tasting sweeter. You can taste the actual sugars in foods that exist, which is very strange to me, but it can happen. It's very wild. So that's something to think about, is that the opiate effects of sugar are real, and that's why it's difficult to stop eating these foods, and the politics behind the food industry. I think another thing to think about is viral hepatitis, as it applies to the United States. We all should be screened at least once for hepatitis A, or hepatitis B, and C. The work that Rosie did in the 90s specifically have offered our country, and not every country, but our country, immunity basically to hepatitis B, and that didn't exist before her work. I was not, for instance, and most of you were not vaccinated for hepatitis B when you were born. And so that's something to get checked. If you haven't been vaccinated for hepatitis B, go back and get checked. It's covered under your insurance. It's totally covered. Hepatitis C also is something to get checked for at least once in your lifetime, especially if you've ever shared a razor with someone or shared a toothbrush, which I know most of us don't share toothbrushes, but even if it's accidental, you can contract hepatitis C and hepatitis B very easily. And also in the medical settings, if you've ever been to a dentist before, then hepatitis C is something you should be checked for. But everyone should be checked over the age of 18, and with every pregnancy, hepatitis C. Your liver is a silent organ, as we've heard. It doesn't do a lot of complaining, so it sustains a lot of damage before you know it's been done. A lot of people will be infected with the disease or have a liver issue, and then they don't find out until later, when they have the flu or something, that their immunity's been compromised, and they find out that their liver is compromised and has disease. So that's how a lot of viral hepatitis is found. So keep in mind, go out, get your hepatitis C screens, get your hepatitis B screens, and get vaccinated for hepatitis B after your screen. And then hepatitis C, we have seen, much like Dr. Starzl was responsible for the modern miracle of liver transplantation, we now have a cure for hepatitis C. Hepatitis C was once considered the most deadly and most contagious disease, and it was the top tier, most deadly, most contagious disease in the CDC, and now we have a cure. It's an 8-week pill that you take, and it's gone. You can be reinfected, but it's curable, so that's amazing. Hepatitis B, not so much. It's still a retrovirus, similar to the HIV/AIDS virus, so you can't ever get rid of it. However, it can be managed, and you should be surveilled, but it's avoidable if you get vaccinated. So 2 things that are avoidable, which are exciting. I know doctors' slide said that 25 to 35% of all US Americans are probably infected with liver disease or affected by liver disease. If you look at the numbers, it could be as close to 60%. with fatty liver in the standard American diet. So it's actually much more common and likely more common than we think. There are ways to have your liver health diagnosed, but like I said, your primary care physicians are not trained to diagnose liver disease, and often we have many diagnoses that divert us from really figuring out that it's liver disease. So there are things you can do, your blood work, we can teach you how to do that. You can calculate your own FIB4 if you have your blood work. If you get a regular ultrasound, it's probably not going to show liver disease. It has to be a liver-specific ultrasound, which isn't available to most people. So that blood work and having that, potential CAT scan and putting all those pieces together and using it as a kind of pronged diagnostic tool is the most important thing to really understand where your liver disease is. There's a lot you can do to stop liver disease. So if you're diagnosed with a late stage liver disease or a stage 4 or something even worse, there are things you can do to stop the progression of liver disease, and whatever healthy cells are left will regenerate. And so you can potentially live without a liver transplant and do a lot of good for your liver and live a healthy life without having to face transplant. And if you do have to face transplant, there's a lot you can do in the meantime to keep your body healthy. So I have talked in every direction, but probably the one I was supposed to. So, but I wanted to address a lot of the questions that came up while we had our other speakers talking. Drugs lists, vitamin E is another one that came up. I think vitamin E is something that has been shown to be effective in the management of fatty liver disease. That's something you can talk to your doctor about. There's also a lot of people ask about supplements. Should I take milk thistle or turmeric and all those things? Most of the hepatologists that I know avoid or recommend avoiding any kind of supplement because they're not regulated. And so in a lot of the turmeric, we're finding high levels of lead and mercury. So that's something it's better not to take it and to stay away from it. People will ask often, for diet, how do I know what to eat and what not to eat? If you think of it as, a Stouffer's creamed corn versus a bag of frozen corn versus a can of corn, which is the best option? The frozen corn, because it doesn't have anything added to it, is the best. The canned being the second option because it just has salt added. And then the souffle, or the corn souffle or whatever it is that Stouffer's has added chemicals and preservatives in it. So that's the least healthy option, if that makes sense. So there are tips and tricks and tools that we can teach you as well that will help you make better decisions for food. Doctor touched on the artificial sweeteners and the chemicals that we see in our foods. Those are, it's always a risk versus reward. Is it better to lose 10% of your body weight and use artificial sweeteners, or is it better to keep eating what you're eating or keep drinking what you're drinking and have it sugary and potentially expose yourself to chemicals? It's probably better to lose weight and to have that healthier weight than to worry about what's in the chemicals or the chemicals in your food, if that makes sense, as long as it's FDA approved. So yes, Andrea.
Yeah, just a comment.
Please,
yeah.
Of course, yes.
I think the other thing about this is, especially when it comes to changing your diet, is you think it has to be like black and white. It has to happen right away. I used to drink Diet Coke by the 2-liter bottle. I went through so many, and it got to a point where I wanted to wean myself off Diet Coke, and that was the only soda I drank. And it took 2 years. And I started with, okay, the 2-liter bottle. All right, I can only have one of those every 2 days, And then I got down to these cans, which were far more expensive, and I didn't make very much money back then. And so I was like, I'm allowed to have 2 cans a day. That's only 24 ounces. And then I got down to 1 can a day. And as you talked about earlier, being able to taste lettuce, over time, I didn't like the taste of Diet Coke as much anymore. I really didn't. But it took 2 years to go from drinking like 2-liter bottles, multiple ones in my fridge constantly, to now the only time I have Diet Coke is if I'm driving and cannot stay awake because it's like 3 shots of espresso because my body's not used to it anymore. But I guess my point is that habits take time. They take time, you know, and if you just change that one thing, like your example
Absolutely.
with corn, start with one tiny thing and just be consistent day after day with it.
And I think, thank you so much, Andrea, and I think another thing to keep in mind is that, you know, not only is liver and liver disease and the word cirrhosis stigmatizing, but psychology and mental health is also stigmatizing. And one of the key components to liver disease and liver health is mental health and healthy thinking, and really reframing in your mind that what you're putting in your mouth is designed to be addictive if it's processed. If it's a processed food, our whole entire economy is based on addicting you to certain foods and having you feel a certain way when you put it in your mouth. And so understanding that it is going to be a process. It is something that is, you know, it's mindfulness, and it's what you're putting in your mouth, and making those difficult choices to get you past the point of that, you know, whatever chemical effect the food is having on your body is really important as well. So whole foods is the most important thing. If you can always make a whole food choice, meaning not the store Whole Foods, even though Rosie and I are big fans of Whole Foods. But yeah, I know, whole paycheck, right? But if you can make a choice of eating whole foods, which is, you know, a whole apple, or let's say a bunch of grapes, you know, think of water content, fresh vegetables or fresh fruits, you know, a piece of grilled chicken that you cook or that you can buy pre-grilled at Trader Joe's or whatever, versus lunch meat that's been processed with salt, versus you know, something that is has been, you know, extruded or has hydrogenated oils or sugars added or preservatives. Anything that is just plain food, real food, is always better for you than the alternative. So.
You know, drinking large quantities of things. I know somebody, and he drank a gallon of chocolate milk every single day, a gallon of chocolate milk. Well, he developed terrible diabetes. He's a diabetic.
Yeah.
You can look at his eye. He is blind in one eye.
Yeah.
His eye has a rupture in it from all that massive sugar, and he's legally blind in that eye because it just ruptured.
Yeah. It really is amazing. Diet is medicine, or food is medicine. It can be. So it can fix a lot of things, which is really interesting. But I'm here for the rest of the day if anybody has questions. I know my talk was, well, you don't know this, but I'm telling you my talk did not go the way I was planning it to go. Because there were all these points and things that I wanted to make, you know, that I heard in other talks and have talked to you, a few of you about questions-wise. But I'm not going to stand any further in the way between you and lunch. So, all right. Thanks, everybody. Thanks.